everyone, my name is Lauren, and today I'm going to talk about using EEG-based emotion testing during the autism diagnostic interview, and then also just exploring different biometrics for improving autism diagnostics. So let's jump into it. So to start off, we're going to start less technical. This is a photo of me, circa probably 2007, and my friend. And I'm going to ask in the next slide, just to keep in your minds, try to see some differences, and then I'll explain kind of. So main kind of differences that you can see are, I don't know, maybe my siblings under the table, the difference in our shirt colors of the one that my friend and me in the blue are wearing, and the difference in our hair colors. But typically, I mean, I'm not sure if anyone said the difference in our neurological type. So me, I'm autistic, and my friend is neurotypical, which I'll explain later. And autism is more or less an invisible condition, so that kind of plays more difficulty in getting diagnosed overall. So the history of just autism diagnostics as a whole has been quite unfortunate, to say the least. Very ableist, and back in 1980, originally the diagnostic criteria was for a lack of interest and severe impairments in communication and bizarre responses. And then this did improve a little bit, but still has the deficits in social communication and social interaction. And again, the main kind of common theme that we can grasp from this, besides like the text is what it's saying, is that there's subjectivity in the person who is understanding these kind of conditions that are being observed in the individual who might be going or undergoing a diagnostic for possibly having autism spectrum disorder. So in addition to kind of getting patient and clinical history of different behaviors, more or less it comes down to the interviewer or the healthcare provider who's kind of understanding, does this person exhibit X trait, and are they exhibiting this trait in a more neurotypical sense, or is it in a more neuroatypical sense? So with that kind of being said, we can kind of explore, so neurotypical just is kind of a standard term. It's not necessarily in diagnostic criteria, but you can kind of just say neurotypical represents kind of the mean population of like neurological types. So people without any like neurodevelopmental disorders would be like called neurotypical. Someone who maybe doesn't have like a traumatic brain injury would be called neurotypical, and then other kind of neurodevelopmental disorders like autism follows under neuroatypical. So like I said prior, assessment, current assessment tools really rely on the subjective interpretation of one's social impairments. So it's having this kind of social communication barrier in this ASD testing. And not only is this required for the diagnostic interview, but this kind of social communication barrier is just a present kind of symptom or in symptomology for people with autism spectrum disorder. So especially what's really important in gauging whether or not someone has symptoms of autism spectrum disorder is kind of the indication of facial expressions, and possibly the lack of understanding these facial expressions could interpret either a positive or like a negative result of whether someone has autism spectrum disorder. Positive kind of meaning more like a more fitting diagnosis, or one maybe being less accurate. So the solution, I was like, let's use technology to kind of remove some of the subjectivity in the interviewer. So I use BCI, Brain Computer Interface Tech, for this. So I use EEG device, EEG consumer neurotech device specifically. Again, this just kind of further validates what I was saying. Having the false representation of emotional responses can really impact the result of if someone is going to be diagnosed with autism. So basically acquiring evident neurological data to back this up can either support the absence of these emotional remarks or the presence. Again, this kind of just goes back onto the neurofeedback, how it's interpreted. You can also put it into a classification model, associating the emotions with the external stimuli. But again, even just having this neuroelectrical activity, it's not enough, but it still kind of facilitates more of an inclusive approach to autism diagnostics and having less of like an objective kind of lens. So I did this experiment on my own. This is actually me in my bedroom. I had a consumer neurotech device on my head, so it's not like the typical electrodes that are on your scalp. It's a little more practical. I found as a result there was a decrease in alpha brainwave activity, increase in delta wave activity, and an increase in beta wave activity. And like I mentioned prior, I am autistic, but again, this is very, I think vary between person to person. But here I was also running through the questionnaire. here's just a diagram of what an EEG, so this is what typically is used in clinical settings, and it's very resource intensive. The pros are the signal quality is pretty much better than you could get at your home. But even for someone who's not a fan of social situations, implementing this into every clinical setting for autism diagnostics is like really not the most favorable thing. So to combat that, we use consumer neurotech, and I was like, let's make an app to integrate the application for the data processing. So not only are you having the neurological data collection, you're also able to kind of integrate it into a mobile app. So again, removes the subjectivity and just really provides more clinical relevance and also just accessibility for all healthcare providers and the patients being involved. And then here's just some examples of like what the user interface of the app looks like that I can walk up for. So for next steps, possibly like finding more technical validity, also to exploring different biometrics. So in this one in particular, I use EEG. You could also look at different eye tracking measurements, and also exploring kind of other ways to gauge activity that could be going on in the brain during these interviews, and just to understand neurodevelopmental disorders as a whole. And then also to just the platform to kind of give an extensive review and really bridge the gap and really have a more inclusive kind of perspective on different neurodivergent conditions. And then yeah, so if anyone wants to contact me, you can scan the code for my LinkedIn, and then my email is there. But yeah, thank you so much. And any questions?